Thank you very much. It's an honor for me to speak and present today, and it's with great gratitude that I thank the Pain Society of Alberta for organizing this amazing conference. And while you might be joining from around the world, I acknowledge that I'm joining here from Edmonton, Alberta, and here this is Treaty 6, so home of the traditional meeting grounds for many Indigenous peoples, including Cree, Saulteaux, Blackfoot, Métis, 𝐒𝐂𝐑𝐈𝐁𝐄, among others. And I acknowledge my role and relationship to the people and to the land. So to begin, I wanted to start actually with a video of music therapy. And they say a picture is worth 1,000 words. So I thought that it would be helpful for you to get a glimpse of how music therapy looks in palliative care. Music is something that can still impact us, it can still touch us, or it can still have an effect on us, even when we're very ill, even when we're dying or taking our last breaths. Music therapy is the use of music or the different elements of music by an accredited music therapist, and using music and the elements to promote wellness or health for patients and families. As a music therapist, our training is in verbal counseling and supportive counseling. I'm able to help patients process whatever comes up for them so that it's a safe experience.
To me, it's important. I look forward to her anytime she can come. It's something that you really look forward to. It helps me cope with what's going on.
Afterwards, they may not be feeling happy per se. It's not necessarily about making people feel happy, but helping them feel, helping them express and connect with what's important.
I think that they're very valuable and give us an opportunity to connect at a very deep level. I sit with him and listen, and we go to those places together, and then we have a chance to talk about them and to share those feelings of love and sadness.
The music therapy has been very important. I really believe in it.
So I hope that you enjoyed being able to see a little bit of music therapy at the bedside and to hear some of Harry's story and his wife. And typically that is how I'm working, is right at the bedside with patients and families in palliative care. So to begin, I'd like to say that I do not have a conflict of interest to disclose. As mentioned, I am on staff at the palliative care tertiary unit at the Grey Nuns Hospital, and also that I have permission to share these stories with you today. So the goals of this presentation will be to introduce music therapy in palliative care and to identify some of the challenges for pain and symptom management, and learn about the different music therapy interventions that might be used, as well as to reflect on the elements inherent in total pain. And total pain is an area that we work with in palliative care quite a lot, especially on our tertiary unit. So just as a definition, palliative care is an approach that improves quality of life for patients and families facing the problems associated with a life-threatening illness through prevention and relief of suffering. And some of the elements that we're working on with our unit is assessment and treatment, and also taking a whole person approach to care. So 3 of the main areas in palliative care is, of course, relief from pain and other symptoms, as well as affirming life and regarding dying as a normal process. And that includes grief, seeing grief as well as a normal process, and then providing some bereavement support for our patients and our families. So I work at the Regional Palliative Care Program, and this is a 23-bed unit and serving palliative patients with quite complex physical symptoms and psychosocial spiritual distress. So our unit tends to actually have younger admissions. We may have patients in their 30s, 40s, sometimes younger, as well as older patients. And that tends to be because sometimes if you're younger living with terminal illness, there can be more complicated situation. You might be working, you might have young children in the home, so there can be sort of a complex interplay between your social situation and your illness. So you can see here listed the different team members that we have. We have quite a robust interdisciplinary team, which is wonderful. We do also, within our interdisciplinary team, have a chaplain, a social worker, a psychologist, and a music therapist. And the majority of our patients would have a cancer diagnosis coming to the TPCU, maybe around 80%. It would depend on the week of admissions. We also serve patients with non-cancer diagnosis as well, ALS, MS, dementia with comorbidities, other types of palliative illness as well. So to tell you a bit about the music therapy program, the program began in 2005, and I'm on staff as permanent part-time music therapist. And so the credentials in Canada is actually to have music therapist accredited, or MTA. So if you're looking to hire a music therapist in Canada, that's what you would want to look for. I have a master's degree from Montreal, as was mentioned, and my work tends to be at the bedside. And I just showed a picture of myself, and then on the right, you can see me with my mask on and PPE as we're practicing these days during the pandemic. So what exactly is music therapy? It is a discipline in which credentialed professionals are using music purposefully within a therapeutic relationship to support the development and the health and the well-being of clients. So some of the key areas in this definition is the use of music or the elements of music in a safe way, and also using music ethically to address human needs. And again, we're looking at goals within a broad range, and pain and physical symptoms will fit within that. If you're interested to learn more about training as a music therapist and the training in the degree, there is different bachelor's and master's programs across Canada. The training, as mentioned in the video, also includes training in counseling skills and supportive skills in order to help process what's coming up for patients within the music therapy session. As you know, listening to music, it can be quite emotional and evocative. And so to have those training and counseling and supportive skills is really helpful. So there's websites here that will be also available in the handouts that you'll receive if you're interested to learn more. I also teach an introduction to music therapy course through the University of Alberta, if you're interested in that. And I think these days everything is going online, so there's more opportunity to access these types of learning opportunities. So we'll get a little bit more into music therapy and how it's looking at the bedside and how we're supporting patients. Here you can see a picture of an intergenerational music therapy session. So the patient is in the middle and her daughter on the right, and myself. So the goal of music therapy is not to promote musical ability in the client, but it's rather to use music as our tool, and music as a tool to develop other types of health goals and potential for the person involved. So music therapists are interested in both the universal impact of music on the body, such as the effect of rhythm on the body or slow, soothing melodies that might promote relaxation. And as well, we're interested in the personal connection of the patient to music. And I would say those two pieces are very key. They've done some interesting research looking at lullabies and the music that we use to soothe our babies to sleep across culture, some ancient lullabies as well as modern lullabies. And they found some interesting similarities between what is a lullaby that is used worldwide. So while the pitches or the tones of the melody might be different depending on the culture or the scale that's used, there are these long kind of sweeping phrases that sigh or that lower at the end. And there's this rocking rhythm, right, that we use when we think of rocking a baby. And also there's sort of a slower tempo or a lilting tempo. So it's interesting to think that there are some universal truths in how music tends to impact the human experience. And as music therapists, we're trained in some of the ways to apply and use music and to have a physiological response. And then the other side of it is the personal connection. So for example, this woman in the picture here, she has her own personal connection to music. maybe songs that are important from her youth or her childhood, maybe songs that have a significant memory or an emotional connection for her, maybe songs that she doesn't prefer and music that she doesn't like. So it's important to know that in terms of how to approach and use music therapy in a way that's therapeutic. So in music therapy, we start with assessment. And in palliative care, this starts with the patient and the family story. Assessment is imperfect and there's room for potential bias, but it does help create a baseline for goal setting. And it's ongoing from multiple sources. So we might have patient referrals directly from the patient or from team members. And as well, looking at the chart review, the medical assessment tools. Tuesday, we have our team conference and morning report. And I would say that assessment is very important to be ongoing in palliative care because the health status of an individual can be changing very quickly. So I might go into a patient room and maybe we've been working on some legacy work. So doing songwriting to write a song for their family member as a legacy gift. But when I walk in that day, they're actually in quite a bit of pain. So I'm going to shift my approach to help use music to support and reduce their pain perception and pain experience. So we need to be quite adaptable in palliative care. These are some of the assessment tools that we're using in palliative care. The Edmonton System Assessment Scale, the ESAS-R, the Edmonton Classification Scale of Cancer Pain, and these are self-report. And then the PPS, the Palliative Performance Scale, and to see the person's function. And here you can just get a glimpse of what these assessment scales look like. And I'll bring a little bit of attention to the Edmonton classification system for cancer pain, in that we're looking at the mechanism of pain. Is it nociceptive? Is there neuropathic pain? And unfortunately, there is a fair bit of neuropathic pain in the patients that are on the TPCU, as well as incident pain. And then, interestingly, to kind of dovetail off some of the discussion already this morning, addressing the psychological component. So is there psychological distress that is impacting how the person is rating or experiencing their pain, and as well as addictive behavior? So it's important for me to know this information because it might also help me in developing how I'm going to approach in the treatment plan that would be supportive for that particular patient. So as we've been discussing all conference, whole person care is a core of music therapy and also work in palliative care. And I'd like to just draw our memory back to 𝐒𝐂𝐑𝐈𝐁𝐄's words right at the beginning of the conference when she talked about her own experience with grief and how when she was having pain, the grief actually exacerbated that pain. And she felt that the internal grief was coming out through the pain in her arms. And how important it was for her to acknowledge that and to get support through that. And in palliative care, our patients are grieving. They're grieving a lot of losses of their physical abilities, maybe loss in relationship, loss of future. And so the ability to meet people where they're at and to help them find ways to express and to process those losses and those grief can go a long way in whole person care and can also impact the pain experience as well. One of the main areas in palliative care is honoring choice. So for patients, this might be choice around treatment, also choice around their spirituality or their culture or the needs of the family. So as a music therapist, I might bring this in terms of bringing in music that is of spiritual support for that person or would be music from their culture. And often I use live music, and I'll speak to why in a few minutes. But other times I might bring in recorded music if that is in a language that I can't speak or sing myself, or to support the patient in their cultural needs as well. And this is a lovely photo of a smudging and pipe ceremonies offered to Indigenous patients to receive traditional healing. And in our unit, we're offering protocol as well. So what's happening in a music therapy session? I think this triad of the client, the therapist, and the music is a good place to start. And the person is coming in with their own history of music and their own needs in the moment. And then the music therapist is interacting with them in the therapeutic space. And developing that therapeutic relationship is really key. And in palliative care, we're often doing that quite quickly because as you may know, we may not have a lot of time together, but that doesn't mean that it isn't meaningful and that we can't actually develop some good goals and work towards some resolution. So what does music therapists do? Patients, it really depends on their physical abilities, their energy, their wishes, and how they might participate. So active music making, patients might be playing instruments, singing, using their voice. Also songwriting is an area that is quite helpful. Movement to music, creative arts, or song choice. On the other side, some patients, due to their fatigue or if there's more cognitive impairments, they might be working more in a receptive method or responding to music. And so this is where we might see some guided imagery work, music relaxation, listening to music, lyric analysis, and of course, reminiscence and life review, which is an important part of palliative care. And it depends on the goal, what type of activity we might be using in music therapy. So the physical effects of music have been researched and documented, and the physical effects of music therapy, there's been some important research coming out. This is an area that there needs to be much more research done. It's rather new in terms of a field, but there has been some significant effects showing to decrease blood pressure, lower heart rate, and affect breathing rate and states of arousal, as well as to decrease the perception of pain, anxiety, and shortness of breath. And music in the brain is an area that, again, is just exploding with research, and there is so much that we don't understand. We do know that there are certain areas of the brain that only respond to music, and they're hardwired for music. We also know that when you sing or play an instrument, many areas of your brain are lighting up, and there's a lot of engagement across different parts of the brain. There's been some fascinating research around using music therapy to help people regain speech after strokes. There's been some important research around those with Parkinson's using music to train to learn how to walk again with gait training. And as well, they're starting to understand a little bit more about the role between music and emotion and how both pleasant music and also music that's disturbing or unpleasant actually is processed differently in our brains. So music can also activate our reward system. Some of the endorphins that it's activating might help in terms of its pleasure and also the moderation of pain. So I think there's still so much to learn in this area, but there is some really interesting research being done. One of the questions people ask is, does music actually replace or override the pain experience with something pleasant or something different? Or does music distract from pain? And I think the answer is yes to both of those. And it might depend on the situation for the patient. But with music's affective properties and the fact that it is linked so much to emotion and to memory, it can actually replace the pain experience with a pleasant experience or a different experience to interrupt that pain cycle. So I like to share this slide in terms of understanding the cycle of pain. And this is a very simple slide, but in terms of the pain cycle, but I think that it will help you to see how, as a music therapist, I might be working. So as we know, physical pain can lead to anxiety, right? Especially anticipatory anxiety, fear that the pain will come again. This can also be linked to muscle tension, holding our breath, and an increase in tension in the body and stress, and which can again make the pain a bit worse. And over time, the cycle of pain is linked in, there's relationships with fatigue, right? It wears us down, insomnia, even depression. So as a music therapist, I'm thinking about how can I interrupt this cycle, in what ways? And maybe there's multiple ways. So first off, maybe as a music therapist, we're going to work with the physical pain experience itself. So that might be doing some work around visualization and music with the pain, working with understanding the pain or like you've probably heard about some of the research with imagery where you imagine changing the pain's color. So those types of processes. Also, sometimes I'm approaching it from a music relaxation standpoint. So someone is in an acute pain crisis, how can we distract with the music and relax their body and get them into their body and breathing and help to bring that sense of arousal and anxiety down. Another time is I might wait until the person is not in a pain crisis or a pain flare and work with them around developing some coping skills with music and imagery. Music is quite a motivator and it's a good stimulus. We can pair it with another thing and it'll help our body to kind of feel that experience more strongly. So for example, if I'm doing some music relaxation and the person has an image that is important to them where they feel relaxed and calm, and we practice their breathing along with the music, then once they're hearing that music later, it can actually trigger that relaxation response faster in the body. So the music is like a cue for their body to remember the relaxation feelings. And so as we practice more and more with the music and with the imagery, that can be something that they can use themselves to help if a pain flare comes. And I often teach families as well to do some of the music relaxation and imagery work so they could support their loved one with that. So the goal is also to have some skills for when I'm not on shift, right? Or if a pain flare happens in the night or in the wee hours of the morning. So another way to think about it is maybe the approach in terms of the level of support that music therapy is providing. So with the supportive level, this is temporary relief from the pain where you're using music perhaps to entrain or some music relaxation as distraction and to bring that level of pain down. And this is a really important level. I would say that there's not a hierarchy here in terms of the three levels. Often in palliative care, this is where we're working, is supportive in the moment, helping people to lessen their pain experience. The specific level for those patients that's appropriate for might be looking at understanding the pain, maybe using some music and imagery techniques or some improvisation to dialogue with the pain or to reflect on their relationship with the pain. And then the comprehensive level could be in using entrainment or else the Bonnie method of guided imagery and music, which I'm trained in, to help more at an advanced level. And this could, for some clients, lead to resolution of pain. In palliative care, it tends not to be resolution, but some really skills to cope with the pain and to lessen the pain experience. Our patients are living with pain that will likely progress. And so the awareness that it is going to be getting worse, but the team is going to help them manage the increase in the pain through increase in medication, non-pharmacological measures as well, that they won't be alone in facing their illness as it does progress. So what kind of music do we use? What would be supportive? People ask, like, is there a song or a type of music that you could use in palliative care? Well, not one size fits all. However, some of the principles of supportive music might be the slower tempo and the steady, predictable rhythm. Also music that has a fairly simple structure with recognizable melodies or themes. Music that is more simple, so there's a constant harmony without a lot of sharp dissonances or shifts, could be more supportive with pain control and stable dynamics. The big caveat here is that patients' preferred music has actually been shown to have a stronger supportive effect in reducing pain. Now, if the patient's preferred music isn't really helping them with their pain, it's actually aggravating or stimulating them too much, then we might look to how can we find music that would be more in the supportive realm, but still has some of the elements that they love about the music they prefer. And one thing to discuss is entrainment. And this is why I tend to use a lot of live music at the bedside. So entrainment is when we can synchronize with the physiological rhythms of the body, so the heart rate, the breathing rate, and then musically, once we're in sync, I can create some physiological change by musically matching the client's rhythms and then influencing it through music. So I'll tell you a story of a client named Red. And he was a client that really loved Johnny Cash. So I'm coming to you from Alberta, so country and Western music. And as his cancer journey progressed, he had more pain, and he also was going into delirium. So we often see pain combined with other symptoms in palliative care. So when he was delirious and in pain, I would go into his room and I would start with some Johnny Cash music. One of the things with pain is you want to start with the music to capture the attention of the person. You want it to engage them cognitively or to get them the brain's attention. So if I went in with like some light little flute, he probably would either kick me out of the room or tell me like, come back later, or else it just wouldn't really have much an effect. So musically, I'm matching the element of his energy. So if he's moving around in bed and agitated, then I'll start the music fairly strong to capture his attention. And once he's engaged with the music, I can just watch his body and see as I start to slow down the rhythm and maybe shift to more of that rocking rhythm, I'm seeing his body settle. So he's not moving around in bed as much. He's becoming more still. And as I'm in training with his breathing, I can slowly start to change the tempo of the music and watch his breathing settle down and settle down. And as I become quieter with my music, I see him more and more calm until he's asleep. So often I will go in several times in the day while they're working on titrating his medication and support his pain reduction and also the reduction of his agitation through live music. So just in my last minutes here of the presentation, I'd like to speak a little bit about total pain. And this is a concept that is quite important in palliative care, and I think it really speaks to the themes that we've been discussing in this conference. So Dame Cicely Saunders, the founder of the modern hospice movement, coined the term total pain to characterize the multidimensional nature of the palliative patient's pain experience. And this is to include the physical, but also the psychological, social, and spiritual domains. So although pain can often be controlled through pharmacological and non-pharmacological methods, poor pain relief continues to be a well-documented reality for many patients. And it's something that we're continuing to work on with our patients. And she speaks that pain is one of the most common and most distressing symptoms in palliative care, and for the families as well. So the complexity of treating patients with total pain is sometimes compounded because it's hard for the patient to actually even distinguish what exactly is the cause of the pain or where the pain is. Sometimes it just hurts. And sometimes patients aren't capable of expressing or maybe even understanding fully as we are kind of the different components of our pain. So one man she wrote about had a lot of pain, and his pain couldn't really be controlled until he was reassured that his son would be taken care of after his death. So his concern for the well-being of his son was really impacting his experience of pain in a total pain way. For others, it might be a sense of despondency, feeling God has left me, or some spiritual distress. And so it's important to be able to listen to patients and to meet them where they are and to understand what is contributing to their experience of pain. So Dame Cicely wrote, "I realized that we need not only better pain control, but also better overall care. People need a space to be themselves." And in the term total pain is from her understanding that dying people have physical, spiritual, psychological, and social pain that must be treated. And I've been working on that ever since, she says. So I'd like to share a story about Grace. Grace was a woman that I worked with breast cancer. And this is an example of total pain that came out in our sessions together. So for Grace, we were working on using the voice, so using vocalization to help with her pain experience. And she had some images that she would use where she would sing And I would sing with her, and we would sing into an area of her body that there was pain to help move that pain and release that feeling. And so we were toning one day on sort of an Om sound. And as we were singing together, she stopped and she said, "It sounds like the word home." So HOME. And so I encouraged her, well, let's switch to that word. So we started to tone on the word home. And as we were singing together, she had a big rush of emotion. Tears came and she just broke down into sobs. So I supported her through that and to explore what was there for her. What was she feeling? And she said that up from the place where she was feeling her pain, it shifted into a huge sense of homesickness, of missing her family, missing her homeland, and feeling disconnected and alone. And so this awareness in her that there was this big sense of grief in terms of missing her people came up. So we shifted in music therapy to sing some songs from her home country and to reminisce about the people that she was missing and her feelings. And then from that, it was motivating for her to realize that she wanted to make some efforts to reconnect with her family. So we brought in some connection with her sister and some phone calls overseas. And it shifted a bit of our work in terms of still working with pain control techniques, and then also supporting this emotional processing and this sense of helping her to resolve or to process some of her feelings of loneliness and grief. So for her, I would say that was an example of total pain and some awareness and some healing that was really able to come for Grace. So in music therapy, as we're working with the physical symptoms such as nausea or pain or agitation and delirium, we're also aware of the other elements that might be interplaying with these physical symptoms, so such as the mental, emotional, and spiritual needs of the patients. Music, because it's nonverbal, can be a way to really foster connection and communication on an emotional level. So I work often with families as well to help them connect with each other and communicate, and to provide, again, sometimes spiritual support, support from the person's culture through music, and to improve quality of life. Music is quite engaging. It captures the attention of the mind. It's something that we can be fully immersed in when we're experiencing it. And that can also help to distract from the pain experience and to improve quality of life for patients. And it can be a lot of fun. It's not always doom and gloom in palliative care. So I'd like to leave you with one final quote. And this again is from Dame Cicely Saunders. She says, "You matter because you are you, and you matter to the end of your life. And we will do all we can, not only to help you die peacefully, but also to live until you die." And for me, that quote really speaks to the work that I do in palliative care and to the immense gratitude and just honor that it is to walk with patients at end of life and support them and their families through music. Thank you very much.